Lovely, welcome everybody. My name's Rabia. I teach at this university, and my area of teaching is in pharmacy practice. And my session is about communication and health literacy. So before I start talking, could I just do a quick hands up? How many medics do we have in the room? One, good. Two, okay, good. How many pharmacists do we have in the room? Okay, good. How many vets? None? Biochemistry, bioscience type people? Lovely. Okay, good. It's just good to get an idea of who's in the room. So I'm going to look at it very much from the perspective of a healthcare professional, which all of you are either training to be or you may be working alongside other health professionals. So when I was thinking about what to include in this session, I think for me it was, why are we talking about communication in the first instance in a conference that's about antimicrobial resistance? And if we look at the World Health Organization, they think that when we're talking about health promotion, which is the way we communicate to people about things that will improve their health, there are three pillars. So this is lifted from their global conference on health promotion. And they think there's three pillars. The first being good governance, second being healthy cities, and the third being health literacy. Now, I think that one and that one, as individual healthcare professionals, we probably have little control over, unless we get involved with setting government policy. But this one, health literacy, is the area where we have the most impact, because we have to think about what is it that patients know about their own health, what skills and knowledge do they need to have about in order to make good choices about their health. So in the UK, we follow a way of thinking about people's health called person-centered care. Has everyone heard of that? Yeah. Good. So when we're thinking about health literacy, you have to have a certain amount of it in order to deliver person-centered care. You can't do it without the person who you're trying to treat or advise about their health knowing a little bit about it in the first instance. So the World Health Organization define it quite scientifically, I guess, in this way. So they say it's the cognitive and social skills which determine the motivation and ability of individuals to gain access to, understand and use information in ways which promote and maintain good health. Or another way of thinking about it, which I think is probably a simpler way, is the skills that people need to be able to navigate, function effectively within the healthcare environment. So it's, what do they need to be able to do in order to make good decisions about their healthcare? When you're saying, would you like this treatment or this treatment? What do they need to know in order to know which one they would actually like? Which one do they actually need? So there's lots of statistics about health literacy, because a lot of work has been done around this. And I find these statistics quite surprising. So they did a study not so long ago which looked at just England alone, and they found that between 43 and 61% of working age adults routinely do not understand health information. That's depending upon where you sit on. If we take the middle of that, it's half of the population who we talk to about healthcare do not understand health information that we give them. And I'm sure all of us, when we're in practice, whatever area of practice we're in, when we're giving information, we think we're being really clear, and we think we're giving it in a way that people will understand. The financial cost of this is 3 to 5% of the annual budget. Now, the reason why there's a financial cost is because if people don't understand what we're telling them about their health, then of course there's a risk that they don't adhere to the regimen that you're prescribing, or the advice you're giving them about what they need to do in terms of their health properly, which then results in poor health. And then that ends up having an impact on the budget. So they did a similar piece of work around health literacy specifically in Scotland, and they found that 26.7% have literacy levels that mean they may face occasional challenges and constrained opportunities due to their skills, but generally will cope with everyday life. So it's occasional challenges. But 3.6% have literacy levels that are so limited they will be faced with serious challenges in everyday life, including when making decisions about health. Now, you find generally very similar statistics across the EU. So when you think about it, that's quite a lot of people. And as health professionals, or people who are going to be working alongside health professions, depending upon your area of practice, low health literacy has a lot of impact on the public and the wider perception of health. So there's been a lot of work done around this to look at, well, okay, so what? So what? People don't understand the decisions about their health. We tell them what to do. As long as they do that, they'll be fine. Actually, it tells you that they have, number one, that's obvious, they're probably going to have poorer knowledge around their health, but they actually end up with increased hospitalisation because they're probably not able to adhere to regimens or treatments or understand what they need to do when. They have a lot more use of A&E services, so emergency care. They tend to not take up screening and immunisation opportunities as frequently. So all of you will be aware at the moment that there's this big problem with getting people immunised against certain things. You've all heard of that, haven't you? And there's this whole anti-vax movement that's suggesting that actually nobody ever needs to be vaccinated against anything, which is, I assume the people in this room would disagree with that. I'm making an assumption. But yeah, so you can see how this group of people who perhaps their health literacy is holding them back are probably those same people that we really need to target, because low health literacy is probably linked to lots of other markers of deprivation. So there's probably poor socioeconomic outputs, they probably live in deprived areas. There's lots and lots of things that kind of add to this picture of low health literacy. And this one, particularly as a pharmacist, that interests me, that people tend to have poorer ability to take their medication properly. Now, the pharmacist in the room will be sitting there thinking, well, with some of the medicines it makes a big difference. And those of you that are interested in antimicrobials will know that with some antibiotics, the regimen frequency, exactly when you take it in the day, makes a huge difference in terms of effect. So with or after food makes a difference because you might not get good absorption. So this has an impact in terms of AMR as well. And then, of course, poorer skills at interpreting medication labelling and other health messages. We probably would expect this one because low health literacy may be actually linked to poor literacy in general. So we tend to think that with all these big campaigns that we have around plain English and, they have these marks, don't they, for clarity that you can see in a lot of documents. And majority of public-facing information about health has to have this clarity check. We think that actually most people will probably understand that, but lots of studies have shown, and the most recent one I think was in 2015, that actually quite a lot of people still don't understand that. So we're still not writing in a clear enough way that people will understand, even when we're bringing it down to really simplified language. So if you think about something really easy like some cold medicine that you might buy in a pharmacy or a supermarket, I'm sure you've all bought some paracetamol at some point. So if you look on the back of the packaging, it should be fairly clear as to what you should do 2-4 times a day. Don't take it for too long and see somebody if it goes on for a really long time, right? But actually, it isn't to everybody. And you then have to think, well, we put everything in writing, and perhaps that isn't necessarily the best way of communicating that, because perhaps we should have diagrams. Maybe that would be clearer. So if you think about, I assume everyone's been on a holiday at least once abroad. Some airports, you've got people flying in from all over the place. What language do you use to put the signs up in? Usually they'll use some kind of diagrammatic representation of where you need to go for what, plus maybe English and another language, because not everyone's going to be able to access the writing. And I think we need to think a bit like that about healthcare as well. Make it as easy as possible for people to understand it. And I think this low health literacy has a huge impact on AMR, and probably one that we underestimate. So they are a hidden population in that you will have no idea who these people are. People tend to be quite compliant. If you ask someone a question, they will give you the answer they think you want. So if you say, did you understand everything I just said? Most people will say yes, even if they didn't. And particularly if you are somebody who perhaps feels as though they have low health literacy, you're more likely to say yes. Why do you think that might be? Why would someone with low health literacy perhaps not share that actually I didn't understand what you just said? Sorry? Shame, yeah, absolutely. And that's been borne out in one of the studies that they looked at. So they said that actually, oh no, I haven't got it on that slide. One of the reasons that people don't disclose it is fear of stigma, fear of being thought of as stupid, fear of jeopardizing the relationship with that health professional. And I thought that third one was the most interesting, because the first two are quite obvious, aren't they? Nobody wants to come across as though they don't understand something that somebody assumes they should. But the third one, which is they don't want to jeopardize the relationship with you guys as health professionals, that's quite a strange one, I think. And perhaps we're not picking up on cues when we're talking to people about what it is that they do and don't understand, and perhaps we need to do a piece of work around that. So the role of health professionals. Now, I picked 3 professions that we at this university train. So I picked pharmacists. So pharmacists in the room will recognise this lovely wheel, which is the standards that we expect pharmacists to adhere to. The medics in the room will recognise the good medical practice standards, and the HCPC people, so that might be biomedical people. BMS, anybody BMS in the room? Good. A few BMS people. So if you were to then register as a biomedical scientist, you would register with the HCPC at some point. Now, there are lots of other societies and bodies. There's one for vets, nurses, dentists, millions. So I was like, let's just pick 3. But all of them, in their standards, have a standard around communication. So with the GPHC one, they've developed it diagrammatically, so it makes it easier for everyone to see. And you can see right there, effective communication is one of the 9 standards that as a pharmacy professional, you are expected to uphold and deliver. In good medical practice, one of the 4 domains is around communication. In standards of conduct, performance and ethics, there is a standard around communication. So every single profession recognises that communication is important, but we tend to think of it as the things we are going to say that way. We don't tend to think of it as understanding what the other person necessarily, where the other person necessarily is, before we start telling them all this great information that we have. So this slide, I always think is funny because, to be fair, we do see a lot of examples of this in practice. I mean, this is quite a ridiculous one. So take 2 for 2 days and skip a day. So somebody's assuming skip means literal skip. But there's lots of examples. So we've had people who are prescribed inhalers. So inhalers are those devices that you use if you've got asthma. You inhale the medicine, it sits in your lungs, and it relieves some of the inflammation, calms down the bronchioles. Now, because it looks like a spray, and people think it's for their chest, we've had people actually spray it on their chest.
It's really funny at work.
Yeah.
Yeah, I don't know if you know that.
No? Sure, no, explain it.
Yeah, it's just YouTube.
Yeah.
It's a YouTube video, and it shows how people like use the inhalers in the wrong way.
Yeah.
And it's really funny.
Absolutely.
As a perfume, kind of.
Yeah.
It's really funny, but it's
Absolutely.
a serious problem.
It is, and that's a failure in us as healthcare professionals, because we didn't actually check. Did they know how to do it properly? Did they understand what we mean? I was talking to one of my overseas pharmacists last week, and she was telling me about an example where a patient had been told to apply a cream locally. So when we say locally, we mean the area that's affected. And then the patient called the pharmacy up a week later and said, well, I'm going to Chicago for a few days. Does that mean I need to just apply it now and not take it with me? Because she thought it meant where she lived. She must only take it where she lives. But that's a miscommunication, isn't it? Because we didn't think, does the person understand what we mean? Now, she was clearly taking it correctly, but only when she was locally within her area. If she was going to go to anywhere else, she felt that perhaps wasn't as important. So what I'm going to do now is I think we should have a bit of a chat and do some activities, because we can't communicate about communicating, we need to do it. And so we'll do that now, and I need to give you the mic back.